Hi, I'm Sue Stileski. I'm a clinical associate professor in the College of Health Sciences, where I am also the director of e-learning. This is at the University of Wisconsin-Milwaukee. I adopted Facebook in two of my online courses this semester because I wanted to increase both the telepresence and social presence among my students and reduce the isolation that students can sometimes feel in the online course. I also wanted to create a sense of community between students through a more natural social atmosphere. So, in other words, using something that many students are already familiar with. I had previously surveyed students and found that the vast majority, nearly 100% of them, cite Facebook as a favorite web page of theirs. So I am a Facebook user and have been for some time. So the tool was familiar to me. I have also had good success in using Facebook to maintain communication among professional members in a professional organization that I'm responsible for. The courses that I adopted Facebook in are large enrollment. One of them is self-paced, and the other is a traditional online course with weekly modules. I use the learning management system tools. For us, that's Desire to Learn extensively, both the course announcements and the asynchronous discussion. So Facebook is not an alternative to conventional course communication. I do insist that students maintain communication through email and the course homepage. They are going into professional programs where that sort of communication, regardless of what the convention is required. And it's very important for me that they learn to adopt the conventions that are in place for whatever system they are working with. However, Facebook offers me some opportunity to enrich and deepen their learning and to build community between them. Often students will comment that they wish they could know the other students in their class a little more personally. So Facebook, should they wish to, gives them the opportunity to connect with each other through the course fan page. I do post some updates to my Facebook course pages. For instance, modules are available, or we'll be doing some additional reporting for the campus, and they should be aware of that. But most of the time, I provide resources that I don't believe the students would locate. Here's a case of something from the CNN Empowered Patient series. Discussing inaccurate diagnosis, which is something that we do talk about in the class rather extensively. This gives the students the sense of lifelong learning, gives them access to resources. I can model for them good resources and good thinking, and also helps them with their information literacy. I do the same in my other course, which is a Introduction to Complementary and Alternative Medicine. Again, there are plenty of current research topics, controversial discussions. Here's one from the NIH, National Center for Complementary Medicine, talking about excessive claims for health supplements. So really advancing the students' learning. The good thing about Facebook, in my estimation, is this lands on their wall where they can, of course, ignore it, but hopefully they won't, and at least they're constantly seeing something from me or from the course page. I try to post not more than a couple of times a week. I did promise the students I would not be flooding their wall with updates. So far, so good. I intend to evaluate the use of Facebook in terms of the students who did subscribe and those who didn't, and make adjustments for the next semester.